4th annual general meeting of the City Health Federation. In particular, I'd like to welcome all our member practices, GPs and the wider primary care team, our partners, including Mediscan Diagnostic Services, Golden Hospital, Bradford Care Alliance, and the VCS Group, as well as our local partners, Avicenna and Kensington Practice and Family Practice. Just some housekeeping before we start. This is being live broadcasted through our live webinar, so I hope you guys don't mind about that. It's the first of many live webinars that we'll have, and we'll talk about that a little bit later. Again, some housekeeping. The toilets are at the back, just up the stairs on the right hand side. We're not expecting any fire alarms, but there are fire exit signs in the rear and the front as well. Okay, so the agenda for today really is just a quick summary from myself about some of our services and perhaps some of the work that we've done around quality improvement activity, as well as some patient engagement work that we've done. And then Dr. Gilcar will then go through some of the quality improvement activities that we've been engaged with in City Health Federation. That will be followed by an award ceremony for all our practices, as well as the wider primary care team, and the mobile projectors as well. We'll follow that with some input from our providers. I'm going to have to, because I think I've got the live webinar on here, so I'm going to have to stop mine. Spare me a second. So just a reminder about City Health. City Health was formed in 2014. Handful of practices. Started off with about 7 or 8 practices, and now has grown to about 25 practices. It represents around 130,000 patients in Bradford. It was set up essentially for two reasons really. One was we wanted to provide services at scale in the community, and secondly we wanted to drive up quality in primary care. And we'll talk about this a bit later. So 2018-19, I suppose it's probably worthwhile just for us to have a bit of a recap in terms of what we've been involved in the last year or so. With Calderdale, I think we've been working with Calderdale. We've got Mr. Martin de Bono here from Calderdale Hospital. He'll talk about the Professor Martin de Bono, and he'll talk about the service a little bit later. That was probably one of our first partnerships with Calderdale Hospital, and the idea was actually providing a local service in Bradford, a local general fertility service in Bradford. I think it's probably seen around about 300 patients, new patients and follow-up patients. The experience that we've had from our patients has been very, very positive, and I think it's been growing. In fact, now we've got a memorandum of understanding with Trust Primary Care, and the service is now being provided at the Ridge Health Centre as well. So I think I'm not going to steal Martin's thunder. I'm sure he's going to talk about it a little bit later. Other services, I think, diagnostic services with Mediscan. Again, that's probably one of the first partners that we've had. Mediscan Diagnostic Services is now in a number of our practices in City. On average, they do between 250 to 300 scans per month. And I think it's not just a number, I think they're also quite keen to drive up quality. So they're here today as well, and they'll talk about their services a little bit later. They've also now recently started a gastroenterology service in the last sort of 2 to 3 months, and there are future plans to have a mobile endoscopy unit in Bradford also. So I think that's a wonderful achievement for City Health and our partners moving forward. And then more recently, I think it's the partnership with Avicenna in terms of the delivery of the anticoagulation services. Some of you might recall that City Health had a partnership with the prescribing support service. I think it was a good partnership, but we felt as though that we'd outgrown that relationship, and we really wanted to work with a local partner. So Dr. Akram Khan is here today, so we're more than happy for him to feedback on the service, and we're hoping to actually grow that service moving forward as well. The family practice has the AQP for skin surgery. So Dr. Amir Khan, I'm not sure he's here today, but we'll summarise some of the services moving forward. So the Practice Quick programs, I think this is sort of an area that we were quite keen on in terms of driving up quality improvement in primary care. And this is again was a joint working arrangement with Pharma, a collaboration. Dr. Gilcar will talk about that a little bit later, but the AF was one of our first ones, and it was a partnership between Medicine Academy, City Health and Pharma. And again, it was a program to look at diagnosis of AF, to look at treatment of AF, and to make changes that were necessary. So that program has now been completed. I think they've been able to go through all the practices, they've been able to do the reviews, they've been able to make some recommendations, some changes, and hopefully we'll be sharing that with you in the near future. Dr. Gilcar will talk about this program. The program now, in terms of quality improvement activity, has now moved on to other areas such as diabetes, and now we have a collaborative arrangement with NAP around diabetes. Again, looking at some of the programs that the CCG has looked at in terms of improving hypoglycemic control, but also in terms of some of the wider problems that we've got in diabetes. Dr. Gilcar will talk about that a little bit later. I'm just going to focus on one or two areas which I think is quite important. City Health has a digital program, and last year we had a collaborative program working with Apple, and I think that's been well received by practices. We were able to enroll over 25 iPads within 20 minutes. But importantly, it wasn't just the enrollment of the iPads for member practices, it was actually the applications that were on there. There was a panel that looked at the apps that were on the iPads. They were screened in terms of usefulness for member practices. So they had areas such as the NHS safeguarding, they had apps on self-care and prevention, on diabetes. There was also a drive that we had on there, and the idea was within this Google Drive was to share documents across all our member practices. So folders and policies such as CQC could be shared across all our member practices. We've screened that further, so we've added some further features to it. So for instance, we've added a Twitter feed to it, and we've added some more self-care and prevention apps to it. It's actually building on some of the work that the CCG have actually been involved in terms of self-care and prevention. And there's an application, I'm not sure if you're familiar with it, called Orca. And Orca essentially are doing the work of the NHS apps library, and essentially they're able to look at different apps that are available and look at how useful they are to different people, also look at the security and usability. And we've looked at that, and we've as a mechanism for us to actually volume purchase apps on behalf of our practices. So we're able to now, literally by one click, we're able to distribute one app across all our member practices. You know, it's very simply done. We volume purchase the application, and we're able to distribute it to all our member practices. Some of the other future digital programs that we're involved in, Clarendon has been involved in a digital program with regards to the friends and family test, and I think I've talked to some of you about it. And the idea behind that was that how can we get our patients to actually feedback through a multiple number of ways? Typically in our practices, they fill in a form, they hand in the friends and family test, we get it back, we send it off to CPRS, and at real time that feedback's been lost. And that's how I felt in my practice. We felt, is there a different way for us to do it? So we worked with a technology company. We created an application that would allow patients to feedback through multiple ways. So we'd use the electronic patient record system through System 1. We'd have a link to say, please would you give us your feedback for your friends and family test, and that feedback would come in real time to the practice, and there'd be a real-time analysis done. So an example would be that in my practice population, what I found, which was quite useful, was that younger people tended to have poorer patient experience compared to older people. So the hardest age group I found was between the 18 to 25-year-old group. Older people above the age of 65, the patient experience was much better. Also, we were able to distill to ethnicity. We were able to look at it from an ethnicity point of view, and we found that Pakistani population, Bangladeshi population, their reported patient experience was actually lower compared to the national population. So we've used that now, we've extended that to the A&E GP streaming unit and also to other practices. We're hoping now, maybe in the near future, that we can roll that out in the future. So it's now, so it started off as a City Health initiative, working with practices. We've now launched, hopefully in March, a portal called Patient Voice, which allows 60,000 organisations to automatically be registered on the system. And it allows patients pretty much nationally to report their patient experience. And then we're going to give that free of charge to all the practices nationally. The technical analysis, that might be something different, but that will be done, that will be provided to all the practices and all organisations, whether hospitals and trusts. And that is a partnership with CQC. So that's something that maybe in the near future, hopefully from March onwards, there'll be a launch of what's called the Patient Voice. Okay, another project that I personally invested quite a significant amount of my time in over the last 3 years has been the Doctors Appraisal Programme. And essentially this was a programme to allow doctors to successfully complete their appraisal for the purposes of revalidation and for their licence to practice. I found the current systems quite fragmented, particularly with regards to the fact that you had to go through different systems to be able to complete your appraisal, such as in terms of your survey, in terms of completing your appraisal, in terms of your CPD. And what I thought this would be a wonderful opportunity for City Health to have an application like this, so we're able to get our practices and our GPs and our healthcare workforce to be able to complete their appraisal in a very simple, user-friendly way. So hopefully that's been widened now, so it's being used at Clarendon and some of the other practices, but hopefully that will again be launched probably in March time. So it's something that is an initiative from Clarendon, but also working with City Health. And more recently, I think we've started a YouTube channel. I think so. The YouTube channel, the idea behind the YouTube channel is that we have a number of things going on. First of all, we have a self-care library. So Bradford Beating Diabetes is one of them. There's a self-care video. I didn't know about it, but I was able to find it and thought that was quite useful to have on our self-care library. There's the Bradford Health Foundation, Bradford Healthy Hearts. Again, an initiative from Bradford District CCG. So that's again on one of them. But again, there's the self-care videos on minor ailments, which we can share with all our member practices. And then building on that, we felt it might be a good opportunity for us to actually do live webinars. So this was an opportunity. So this has been live broadcasted on our Bradford City Health Federation YouTube channel. Our future plans are actually, once we give these nebula capsules, is that to allow practices to actually be able to access live broadcasting in their practice and potentially claim for their PLT from the CCG. We've had some conversations with Jill Taylor's on this, and she's quite keen to see and to explore this. So the idea would be that the practices would have iPads, so they can go on their iPads and access the YouTube. The second option would be that to use the Nebula capsule and to just search for Bradford City Health and to be able to see a live webinar on diabetes, on AF, on mental health, and a whole host of things. So hopefully, and those videos would then be uploaded onto the YouTube channel, so if the practice team wanted access to that at a later time, they could actually do that. So that's a bit of innovation that we've tried, and we're testing today, so hopefully it's successful. So you can actually find this if you go to YouTube and just type in Bradford City Health Federation. You'll be able to find the self-care videos, and there's some self-care videos on there. Just going to ask Martin to come and talk about the partnership with City Health. A couple of slides, I think Martin will be fine.
Thank you. Thank you very much. Thanks. Sorry. Thank you very much. Just a brief overview of how things have been going over the past couple of years. We make no bones about it. We'd like to be the provider of choice for fertility services for City Health. Last year, over 2018, we looked at our figures. We had about 120 referrals. One or two things I want to emphasise so that we can just have a smooth flow of the pathway it's really, really essential that for the first appointment, couples come together. We can't see a woman on her own for the first appointment. Both of them need to be at the first appointment. There's a number of legal documentation that they need to sign regarding welfare of the child, and it's really important that both come together. Another thing to mention is that for those of you who don't know, our service has now expanded into the Ridge, as well as Wahid actually mentioned. We have a fortnightly service that actually runs on a Friday morning from Clarendon Medical Centre, and on a Friday afternoon from the Ridge. We are actually going to put on some additional clinics to keep the referral waiting times down, which are currently about 6 to 8 weeks from point of referral. And the strength, I suppose, of Yorkshire Fertility, if I had to actually say so myself, is we've built our brand on partnering, for example, with primary care, partnering with other services that we cannot provide. So we've partnered with Leeds Fertility, we've partnered with Care Manchester, we've partnered with Manchester Fertility. Why? Specifically with Manchester Fertility, because they have a massive egg donation pool. So we now partnered with them, so our patients, your patients, can have immediate access to egg donation if they require egg donation. And we've also partnered with some European organisations because some patients prefer treatments abroad for certain conditions. So that's our strength in partnering. The other thing to mention is we are an NHS service, but we're an NHS service that both has a traditional NHS arm and a self-funded arm. As you all know, there are restrictions, for example, on IVF that are placed on access by the 10 CCGs in Yorkshire and Humber. Don't be dissuaded from referring your patients if they are not eligible for NHS treatment, because they can come through the NHS system but self-fund whilst they actually come through that. So refer in exactly the same way, even though they may not be eligible. And the final thing is I want to ask Sue McCain to briefly mention an issue that is very pertinent to very pertinent to Bradford because of the large Asian Pakistani population that we actually have in Bradford, and with regard to visa and visa restrictions. The Home Office has imposed significant visa restrictions on healthcare and healthcare eligibility, but then especially on fertility. So fertility, they've racked it up a bit more. We're quite happy to see these patients, but they need to be aware that they have to pay for their consultations, because they may not be eligible for NHS care in its definition. So you may need to question your patients before referral and make them aware of those changes. But Sue will talk a bit more about that.
So since August of 2017, the government changed that anybody who wasn't on a permanent residency card couldn't have fertility treatment on the NHS. So we have an overseas team who checked all our appointments, be it Bradford, Dewsbury, Pinderfield, and 2 weeks before their allotted appointment time, the team will come up to me, say these patients are eligible. We cancel their appointment, we send out the overseas letter to them, which explains why they can't have treatment on the NHS. the government website that they can look on, and we send out cancellation letters so they're aware why their appointment's been cancelled. If we actually want to take up fertility treatment within our unit, there's an initial payment of £244.50 to get them onto our clinic, and then we take it from there. So that's how we work. So if anybody wants to refer into us, there's a few different things. We only want one referral per couple, preferably in the female name, because that's who we check against to make sure she's eligible for NHS treatment. But we would also like the partner's
details.
No, I'm all right. So we need a name and a date of birth. We're not bothered about an NHS number because we can find them on the spine. Because we're finding that people are referring both couple, so we're getting two
different referrals for the same couple.
Yeah, so we only want one per couple. And I think that's it really.
Okay.
Yeah.
Okay. We collect regular feedback from all our patients. Please be assured we're getting great feedback for the service, for the local service. Patients really value it. The latest thing that we've actually innovated on is we've added onto our service now our virtual patient consultations. We've added a flyer of the virtual patient consultation on the brochure. We fully appreciate that couples who unfortunately are infertile are most likely both of them to be working, and it's really difficult for them to take time off. And we're promoting more and more so virtual patient consultations where we can have a triangular conference with video, as long as patients have a laptop, internet and a camera attached to their laptop, as most people have nowadays. So thank you for your support. The other thing I want to encourage finally, and one of the missions in a sense when we first mooted the service was an open invitation for all UGP colleagues to sit in on our clinics. That invitation is still there. We would welcome you with open arms as part of your postgraduate education to sit in on fertility clinics. Please don't just turn up. Contact Sue, and we'll just then be aware that you're turning up. I think it's a great way of exposing yourselves to the specialty. There's nothing better than sitting in on an outpatient service and see how it actually operates. So that invitation is still open there, and we would welcome you to attend. As I said, we operate from two bases, Clarendon and the Ridge, whichever is more convenient for you. It's normally on a fortnightly Friday, second and fourth Fridays of the month. Second and fourth Fridays of the month, Clarendon in the morning, Ridge in the afternoon. And again, thank you very much for your support.
So I'd like to invite Dr. Gilcart, who talked about the extended hub access as well as the quality improvement.
Thank you everyone for coming today. I've only got a few slides because we've got quite a long agenda, but I just wanted to update everybody about what City Health has been doing in terms of our quality improvement programs, which are really innovative and quite pioneering. But first I just wanted to speak about the extended access, which I think most of it's been rolled out all across the Bradford area since October. But we actually started collaborating with the BCA to start the first hub, the central hub, which was kindly hosted by Picton Medical Practice. So that was the first hub, and we were quite keen to get involved as a federation in the running of that hub, because a lot of it was about access to patients' access to GP services outside of the core hours, and also about eventually nursing provision as well. So the first hub, as I said, was at Westbourne in the Picton Medical Practice. In terms of the shifts, we've had 99% coverage of all the shifts. So if you think about all the doctors' shifts, doctors' clinics that we have running from almost a year and a half ago now, I think it is, we've had 99% cover, which is not bad. If you think about, doctors can obviously are human, they can get sick, they can get confused about their shifts. That's happened a couple of times. But apart from that, we've had a 99% coverage of all the shifts. So that's meant that we were able to fine-tune the system in terms of the rota and getting a bank of doctors to cover all the days. Because it started off initially Monday to Friday and then expanded into the Saturday and Sunday. And you need to have a very resilient group of bank of doctors to cover weekends and bank holidays, and over the winter period we had to provide extra shifts to help with the winter pressures program, and over Easter. So I think we did really well, and BCA I think were really impressed, and that led them to set up the other two hubs that work directly with the Federation of the Districts area as well, TBC, because it just made sense, rather than working with each individual practice, to have an overarching federation that took the responsibility of filling the shifts, the bank of doctors, indemnity, and all these other costs that an individual practice wouldn't be able to bear and probably wouldn't be able to cover themselves. So as I said, we've had really positive feedback from the patients. We've been doing friends and family tests and also direct questionnaires, which has been collated by the Federation and passed to the BCA. So we've had really positive feedback. Not always good. So a lot of patients like the Saturday, Sunday clinics, which we thought might not be as popular. So a lot of them do appreciate those clinics. So we actually have carried on with the Saturday, Sunday clinics because of the feedback that we had from patients and some carers. We just found it was just easier to get, their loved ones to see a doctor. So, if you're not going to do a tick box exercise, then we have to follow that advice, and BCA led on that. So the central hub has weekend appointments, doctor's appointments, and now it's expanded into nursing provision now. So we have healthcare assistant appointments and practice nurse appointments, which are banked at Picton and also at the Ridge and Shipley, which are the other two hubs. So we've been really heavily involved in that, and we fully managed the whole of the central hub. In terms of our QUIP program, I think most of you will know last year we were pioneering what they call a joint collaborative agreement between pharma and federations. It's a new thing that was basically approved by NHS England and ABPI approved, that the NHS England wanted GP federations that were sprouting up to work directly with pharma, because there was a lot of collaborative work going between pharma and general practice, but it was on an individual practice basis. So a lot of you will have had people like Interface come and do a survey at your practice, people like Oberoi working, sending a nurse to your practice and doing a quality improvement project almost in your practice. And then those nurses were kind of like third party from the pharma industry, and they were having to individually go to each practice. So you can imagine if they wanted to cover the whole of Bradford area, they would have to get a nurse to go to 67 individual practices. So a lot of practices weren't taking up these quality initiative programs. So this was a way of NHS England getting collaboration directly between pharmaceutical companies and GP Federation. And we pioneered one of the first ones last year. It was the joint collaborative agreement is something that was drawn up by NHS England and has been approved by the API. And that formed a template for how we were going to work with. So Daiichi Sankyo were the first pharma company that worked directly with us, and as a result of that program, we had that engagement, very large engagement event at Douglas Mill, and we were able to, through that investment, able to buy the My Diagnostic Sticks for every practice. So every practice was starting to then screen their patients according to whatever risk factors they felt, target their screening to look for AF patients, because obviously, because of our population and because of our demographics, our AF prevalence is always low, and sometimes we need to justify it. And if you screen a lot of your patients and are able to show that you've done that, the CQC will understand that, NHS England, and obviously the PCC at the CCG will understand that even though you're highlighted as red on your GPOS data for AF, you've done a quality improvement program. We're able to provide you with that report, and you can, when the lovely Debbie Oxley comes knocking on your door, or Jill Towers, you can hand that to her and say, Debbie, we've screened all our patients. We found every AF patient we could possibly find, and we're going to do that regularly. And that gives them assurance that, you know, we're not just saying that, we actually have done something to proactively find those people. And the second phase of that program was to then get Medicines Academy and the clinical leads, myself and Dr. Lee, to go through the AF register of our practices and actually look at how those AF patients are managed and make sure that their risk factors are being properly managed, that whether they need to be on warfarin or whether they can be put on a NOAC, and what's the most cost-effective NOAC. So it was quite a thorough process, and I think Medicines Academy, Roman's there, if you just stand up for us, Roman. If you've not seen Roman, he leads the project, and he's been around all the practices, so he's now going to do phase 2, which is acting out the actions and recommendations. So if your own pharmacist or your own clinical lead wants to action those recommendations, they can do, but he's quite happy because he's been set up on your practice, you've given him access to your system, he's happy to action those for you once your lead GP gives the nod. So it just reduces the workload for you. He's able to tidy up your AF register as well as your CHADS risk, vascular risk score. So it just ticks your quaff as well. And hopefully you'll be able to run some reports to show that yeah, we have found some new AF patients, and we are managing our AF patients according to NICE guidance and in a more benchmarked and gold standard way right across our practices, hopefully. So as a result of this collaboration, we are now looking at future collaborative programs. So if I go, we'll start with diabetes. That's the main one that we wanted to focus on this year, because obviously there's a lot of diabetes work that's currently going on. The DQUIP program, the structured education program. You're probably overloaded with diabetes, but I think it's such a high priority for our area because of the prevalence and because of the new hub and spoke system that hopefully will roll out. It's really important that we get our diabetes register tidy, managed effectively. So I don't want to go through the whole program, because if I just point to the back table, we're partnering with NAP. So we've got Leon and Rupert, who are the leadership team from NAP, and they're going to be working with us collaboratively, like with the AF program. We had a pharma partnership. We're going to have a partnership agreement with them, which will allow us to do a quality improvement program right across all the practices that sign up to the QUIP. And that will be match funded, so half the funding will come from NAP and half the funding will come from the Federation. And that will allow us to use Roman's team and engage with the practices and do an incentive scheme that will hopefully drive this diabetes quality improvement program for next year. Now, we're going to have a big engagement event like we did for the AF QUIP So it's going to be at the next members meeting, which is on the 27th of February, which is a Wednesday evening. So that you'll get an email and an invite for that, and there'll be signing in sheets and sign-up sheets after you've had the presentation. They're very similar to what we had for the AF Quip. And off the back of this, because it's been so successful, other pharma companies are wanting to work with us in a similar way because they can see the benefits of this, because it's one of the first places in England, definitely, I don't know about maybe the UK even, where there's been a direct collaborative quality improvement program between a federation and the pharma industry directly. And once the other pharma companies heard about this and saw how effective it was, we've got a few more quality improvement programs that are going to happen over the next 12 months. So one of them is bone health, bone metabolism. So a lot of the pharma companies that deal with vitamin D, that deal with the bone absorption medication and osteoporosis, they would like to work with us to look at our osteoporosis register and our patients and make sure that they're effectively being managed and having the right investigations and treatment. We've got dyspepsia quality improvement program, because Bradford has been highlighted as having one of the highest spends of PPIs in the country, and so there's a lot of quality quality markers associated with that in terms of potentially missing gastro diseases. So that's something that we're going to be doing. And then hopefully partnering with Dr. Yusuf Bini and the CVD program, we will be hopefully helping in delivering the heart failure quip, which he's working on for both CCGs. So it's really interesting stuff. At the end of the day, this is all about improving patient outcomes, and we have one final one that we've just approved a few weeks ago, and it's about opiate prescribing, because there's a massive amount of opiate prescribing, a lot of addiction, a lot of complications from opiate prescribing in terms of dependence, constipation, mental health problems. So we are working with a few companies to look at opiate prescribing. So all these are quality improvement programs that the Federation is going to recommend, and we're going to invite you to engagement events to hear about what the program's about, and then obviously it's up to each individual practice whether they want to sign up for that quality improvement program, but hopefully it should be as pain-free and effective as the AF Quip that we've been through, and hopefully you'll find it as productive. Finally, CQC. It was really important for us to get CQC registration, and I think similar to the BCA, who went through that process, painful process, and I went through with them. It's very complicated. It's not like, it's more complicated than a practice CQC, even if you know how complicated that is and how painful that is. But for an organisation like a federation or an alliance like BCA, CQC don't really understand what they are, and they don't really comprehend it, so you kind of have to explain it to them, and then they go through. So it's quite a long, laborious process, but we're nearly at the end of it. And so hopefully in the next few months we will have a full CQC visit, interview, myself and the board members, and we'll get CQC registration. And in order to get ready for it, we had to get an integrated governance framework in terms of clinical and administrative governance, very similar to what CCGs had to go through, insurance framework and stuff. And what it means is that we have a structure like this, where our board members who are elected and also our appointed managers oversee a lot of committees, very similar to what the BCA has. So you have a finance committee, information governance committee, a health committee, infection control, contract and operating, and they give assurance to the board as well as to the practices that the services that we are providing are safe, effective, financially viable, and meet all the controls. And this is what the CQC want, as for any organisation. So hopefully we should have all that in place for when our visit occurs. And finally, I'm going to pass you on to Dr. Hussain, who's just going to explain about our PLT sessions and how we hope to expand the educational webinars, and hopefully we'll start handing out the projectors to the practices that are here today.
Thank you very much. Yeah, so I think with regards to the PLT sessions, I had a conversation with Jill Towers on the same topic this time. And her feedback was that many of the practices were sometimes not even claiming their PLT, and also the attendance at some of the educational events that we had wasn't always great, and possibly because of the fact that practices are very busy, they're managing competing priorities, they can't always release all their staff to some of the educational events. And I suppose there was a bit of an unmet need then in terms of how do we get practices to potentially attend some of these educational events, how do we actually share that and disseminate that information, and also how can they actually then also claim for their PLT with regards to from the CCG perspective. So before I had a discussion with Dr. Kilcar and said, look, we might be able to do something on this, perhaps maybe have live webinars, and he said, it's a brilliant idea, Wahid. Go away and do it. So we went away and we did a bit of research to see how we could actually do it, and it took us a little bit of time to work out. We over about 6 months period for us to look at it. We tested it out. Dr. Gilcar was on a live webinar a couple of times, myself and my common practice, and so I think we've kind of understand the technology a little bit now, a bit better than we perhaps did some time ago. So the idea then is really to have perhaps maybe in the future an education event in any practice. Imagine you've got one going on in, say, Kensington Partnership, an educational event that's going on there, and all the practices are able to log in on their YouTube, you know, just searching Bradford City Health Federation, or maybe going on a website, and they're able to see the live broadcasting. And if they've missed it, they're able to then access it on the video library. And that's the idea, and it's quite simple. We've not tried to complicate it too much. So hopefully in the future, Dr. Gilcar's talked about the launch of the diabetes quick program. So hopefully that might be another one that we'll hopefully have as a live broadcasted. And then in the future, perhaps bone health and some of the other ones that we've talked about. So then, I suppose once you've got that, the idea was that some practices perhaps don't have projectors. And that's what we felt, that could we have a projector perhaps for each practice, so they're able to then access these videos. And we did a little bit of research on this. We actually tested a couple of projectors, and we found that this one's probably one of the best ones in the market. It's called a Nebula Capsule. It's already got the YouTube already on there. It's also got other bits as well in terms of entertainment, but we've obviously bought it for an educational purpose. So I'm sure you're going to use it for educational purposes.
Wi-Fi as well. It's wireless, isn't it?
Yeah, so it's wireless. It configures with your phone. It configures with your Android phone. It configures with your iPad, so you can able to distribute it onto it. But more importantly, it's got its own Wi-Fi. So you simply go on the YouTube app, you search for Bradford City Health, and that's it. And you can see the live broadcast. And it's actually pretty good quality. You'll probably see it. People sometimes use it for camping. People use it for all sorts of purposes. But we thought we've used it in the practice, and it actually works very well. And it doesn't need a tripod. It just sits there. It's almost like the size of a Coke can, but its quality is pretty good. It's probably the best one in the market in terms of what we could actually find. So yeah, so we're giving one to each member practice as part of our engagement strategy. Hopefully you'll find it useful, but as well, it's not just about, like the iPads, it's not just about giving you a piece of technology. We need to get the content as well. So we'll be working on the content. So I'd like to invite.
Can I just explain?
Yeah.
So just so that there's no confusion, just give you an example of what we're doing. So one of the first ones we're going to do is the shingles update. So because we test run it at our practice and webinared it to Clarendon London, Kensington, Woodroyd. So we were able to perfect it, so we're going to repeat that. So it'll be a shingles update, and basically a shingles speaker from whatever they're called, the company. The lady who's the expert in that is going to do a presentation, which we will then webinar to every practice. So in your practice, you'll have your iPad, your Wi-Fi with this projector. You can project it onto any screen and invite any members of your staff at 12 o'clock or 12:30, whatever time we decide. It's going to be a 1 hour, 1.5 hour presentation. And then we will then webinar that presentation to all the practices. Because it's on your iPad, we will know which practices have logged in. And because you can make comments, you can ask questions, which we can then ask the speaker. So it's interactive, it's not just people sat there watching. You can ask questions through the comments and we'll be able to answer them live on the broadcast. Now the people that can't attend and are away, maybe they're on annual leave, that video will then be embedded into the members' site of the City Federation. So when they come back, they can watch it. Or they can watch it while they're on holiday, if they're that bored. So it means that there's a library of PLT sessions, which will be accredited hopefully by Jill Towers and the Federation, which means that they'll be able to claim, you'll be able to claim those as active learning PLT sessions at your practice. And because we're going to collaborate with the CCG, we're going to make sure that we cover the topics that matter to the CCG and matter to the Federation. So it's a it's a win-win situation for all practices, and also means that you can use these in your practice meetings. So on your iPad, you'll have System 1 activated. You can, in your meetings, you can use the projectors to project that onto a board and go through patients if you don't have the projector system in your practice.
I'd like to pass it all into Elaine and Nicole. So we've got a list of all the practices. I invite Dr. Imaraja Partners.
I've been up for a little while, right?
Clarendon.
Yeah.
I'm fucking fucking things.
Yes.
So the reason we're just calling out is that obviously to get this projector, you have to attend the AGM, you have to sign for it, and you're taking full responsibility. The Federation can't take responsibility for damages, breakages. You're not going to get another one, so that's why there's a signing-in process. Yeah, so the next practice is Dr. Gilcar from Little Horn Medical Centre. Grange Medical Practice. Parkside Surgery, please. This won't take long, there's only 25. Park Grange Surgery, please.
We have Lister Surgery.
Lister Surgery. Lister and City. Alright. Okay, Lister and City. And then Family and Akbar Surgery, please. Picton Medical Centre, please.
It's not actually
How many tweets have you done in the past hour? A few. Thousands. Not 1,000. Not 2 more. Just hashtag really weird stuff.
Clarendon Medical Centre, I think Melicia's coming up there. Frising Hall Medical Centre. Valley View Surgery, please. Peel Park Surgery, please. Bilton Medical Practice, please. Moore Park Medical Practice, please. Kensington Street Surgery, please.
That's you, isn't it?
I can't give it to myself. Bradford Student Health, please. Kensington Partnership, please. Ashwell Medical Centre, please.
That's as high as it goes. You can choose from here.
Manor Medical Practice, please. Previously known as Phoenix. Are you?
You can do it through.
No.
Right.
Yes. And finally, Abbey Medical Centre. It's just, this was not to make everybody get up. I think it's just important to make everybody sign so that they know it's recorded, they've taken possession, it's your responsibility, you're not getting a replacement. But it's important because as we buy equipment and invest in practices, we can't be responsible for the practices provision of maintenance, or if we were to buy DCA machines, you know, cartridges, calibration and things like that. So every time we give out equipment, we need to make sure that we get a signature from the practice and go to it. Anyway, so the next bit of tonight's presentation, I think it was important, we felt that the practices in City are rewarded for their hard work and dedication, because we work in a pretty challenging area, I would say. We have quite challenging patients, a lot of health needs. You know, it's hard work, and I think the CCG and BCA appreciate it as well. You know, they've worked in this area. Karen's been in this area ages.
Yes, yeah.
When it was called the FHSA, or
Before that.
even before that. And it's a hard population to look after, but there's a lot of health needs. We know our patients can be very ill. They can be very poorly, but there's a lot of minor illness, there's a lot of pressure. And I think practices just need to be, and especially our federation practices, I think they need a bit of reward and recognition for the hard work that they do. And I think every year it's getting harder. I think CQC has put a lot of pressure on us. I think the QOF is hard in itself, the incentive schemes that we have to cover, the visits that we have to cover, extended access, extended hours. You know, there's a lot of pressure, and I think this is something we want to do every year. And I think it's an investment in our staff and our practices. So it's not the Oscars, but it's close as we could get to the Oscars. So every year, what we would like to do, we sent out nomination forms to every practice, and every practice could then nominate, do as many nominations as they want, or even nominate another practice. So it's quite free. Very simple nomination form. It goes to a panel, which this year was myself, Dr. Hussain, and the two managers. And just to make sure it was above board, we excluded our practices and staff from being nominated because we want the first one to be successful, and then in the future we'll hopefully have an independent panel that makes that decision. So our practices and our staff have been excluded from this year's awards ceremony because we want to make sure that that everybody realises that it was a panel decision, independent, based on nominations, and in a genuine way to try and reward the people that we felt deserved the recognition from the forms that were in front of us and what we knew of those people. Okay, so unlike the Oscars, we're going to start with the top prize. So don't leave you in suspense. So this year we've had quite a lot of nominations, by the way. So it's been quite competitive, and we had quite a hard time making the decisions. But this practice, I think, deserved this prize because they're very hardworking. They show a lot of passion for their patients. They show a lot of dedication to their patients. The members of the practice, the leaders in the practice, are always there if you need help. If you ask them for help, they're there. They step up to represent the Federation whenever we ask them to, and they always provide feedback. When an email goes out asking for information, you can guarantee that this practice will probably be one of the first ones to respond. And we thought that they deserved recognition for all the hard work that they do. So I'll pass you on to Dr. Hussain, who's going to announce the GP practice of the year 2019.
The award goes to Frising Hall Medical Centre. The prize is a large hamper from Harvey Nicks. The price of so many alcohol.
Phil, can you just get a bit closer? Don't do your back pickup track time. There's no locums available this week. Okay, so the next part, this is not, by the way, in order of like, we have to put GP there on top, it's just the way it came out. Just in case anybody's surprised, GP at the top. So GP of the year. I think this was really to reward this GP because they've worked in this area for many years. They're very dedicated. Their clinical skills are amazing. And I've seen that myself. And I've seen it from other colleagues. They will tell you that this chap knows his medicine inside out. He's very bread and butter GP. So he's doing clinics all the time. Does a lot of the admin work himself. He does all the home visits himself. He does all the cancer reviews himself. If there's a patient that needs a death certificate over the weekend, he will come and do them. So he's very dedicated. Patients love him. He gets amazing feedback. And he's a pretty nice guy. So the GP of the year, and the prize.
So the prize is a leather designer doctor's bag. The GP is Dr. Alan Coker.
practice is an amazing practice nurse. So they do so much. I mean, in the days when general practice first started, a lot of GPs used to do the diabetes clinics, used to do the asthma clinics, used to do all sorts. Now that is often run by the practice nurse. They often are prescribers, they often deal with complex cases and just go to the GP for advice for the really complicated cases. So I think it's a very important role, and nowadays practice nurses are also engaging with patients, referring for diabetes structured education, liaising with the VCS, working with the podiatry teams. It's an amazing role. And this young lady, I think, has worked her socks off. She came from Scotland, I think, you can tell from her accent, and moved to the Bradford area and has worked in Bradford practices since then, and has worked in the extended access clinics as well, covering a lot of the shifts even when the other nurses are off or on annual leave. She's worked at several practices, but her main practices have been Peel Park and Hillside Bridge. So I'll let Wahid.
So the prize for this is a Tom Ford fragrance gift set. And the practice nurse is Abby Ilyas from Peel Park.
And the next one's healthcare assistants, because they've become an integral part of general practice, really. They do a lot of the diagnostic tests, they do, in city practices, they do foot checks, moderate to low risk, they do a lot of referrals, they do a lot of assessments, they do flu jabs, they do B12 injections, they do pneumococcal, they're almost like practice nurses now. The cheap version of a practice nurse. But I think they work twice as hard as any practice nurse that I know, and often they don't get the recognition that their role deserves, I think. So in City we've been very blessed. We've had quite a group of young healthcare assistants that have been developed and nurtured in the City practices, and this particular healthcare assistant, I think, got glowing nominations from several practices actually, and because of the input into the Eastern European population, which has become a big factor in our area, I think it's really important that, you know, she represents an often overlooked section of our population that doesn't need as much input as the historical demographics in our area. So I'll let Wahid.
So the prize for this is a gift voucher at the Trinity Centre for Leeds and a meal for two at Craft House. The HCA of the year for 2019 is Ivona Dilek Basic.
The next one is practice receptionist / administrator. It's one of the whole practice team. This was the most competitive, so there was quite a lot of nominations in this category, which kind of shows, you know, that the you know, admin and receptionists are well respected in our practices, because they often bear the brunt of a lot of, you know, frontline demand, put it that way, and often take a lot of heat for practices. So I wasn't surprised that this was going to be the most competitive. We decided to share it in this nomination because these two girls have worked so hard, and we've seen it ourselves. So not only in their own practice, but they've also worked extremely hard in the extended access services and gone above and beyond what I would say is the call of duty for their role. They've worked so hard, they've chased doctors when they haven't turned up for shifts. They've cleaned up rooms after doctors when really the doctors should have cleaned up the room themselves. They have called banks of doctors when a doctor has gone off sick so that the patients don't have to be sent back to their practice to be rebooked. They have fixed printers, they've worked so hard. So I've seen that myself, and I think it's well deserved, and they really do deserve this prize.
So the prize for this is an overnight stay for two at the Titanic Spa. And the receptionists of the years are shared between Farah, Mahmoud and Afia Sheikh from Picture Medical Company.
Practice manager, because the job of a practice manager, I've seen it with my own eyes, it's become so stressful, so much pressure, both finances, staff, HR, work with the CCG, work with the Federation, go to this meeting, get your CQC ready. It's hard work, and I think we're quite lucky in City. We've got some amazing practice managers here. And why they would want to work in Bradford when they could work in sunny Harrogate or Leeds or that fancy London down south, I don't know. But they choose to work in Bradford and they work their socks off. And there was quite a few nominations for this, but the reason that we picked this candidate was because she's worked in City for years, worked so hard. And I think everybody would know, like, if you ask her for help, she'll drop everything to help you, whatever the time of day, whenever you need her. She has such a caring and loving nature. She actually genuinely cares about the practices, all the practices in the City, the patients. I don't think I've ever heard a bad word about her ever in the 20 plus years that I've been in City. And I don't think she's got the full recognition that she deserves for the lifetime of work that she's given to Bradford City. So, I'll pass it over to Wahid.
So the prize for this is an overnight stay for two at the Titanic Spa, and the practice manager of the year is Pauline Woodrow.
And finally, the last one. The last one is Collaborative Partner of the Year. We have quite a few collaborative partners. Even the CCG is a collaborative partner. Maybe next year. So I think it's really important to recognise the partners that we work with, because if we don't have build a working and relationship with our partners, we will not develop as an organisation. So there are a lot of partners we work with, not just Calderdale and Mediscan and these private providers. We also work with the BCA, we work with the Hospital Trust, we work with the VCS, we work with the council. So our partners are enlarging all the time, and obviously we have our member practices as well. But the partner that we picked, because this is the first awards ceremony, we hope to do this every year. The partner we picked is the one who has started with us right from day one, when we were just a handful of practices with no board, no constitution, no articles, and they had the confidence in us that this organisation can develop and we can mature with them and work with them. And they've stuck with us throughout the last 5 years, and hopefully are going to develop more services in collaboration with us going forward. So I'm going to pass you over to Wahid to name the collaborative partner of the year.
So the prize for this is a Harvey Nicks hamper, and the collaborative partner of the year for 2019 is Mediscan.
And because I know how religious the man is, we've removed the alcohol from it. So alcohol-free halal hamper is taking back to baptism. That's been taken back. I hope back.
I suppose this is probably a good opportunity also for now for Mediscan Diagnostic Services as one of our main partners to come and talk about some of their services and some of their plans in the future, working with City Health Federation. So is it Yasser who's coming forward to have a discussion?
Thank you so much, Dr. Wahid, and all the member practices. It's been quite a while, as Dr. Stein mentioned, that we're working with the Federation for the last 5 years, and it's been a wonderful experience. And this is the reason we are not growing through for the ultrasound services that we provide. Since 5 years now, we are bringing more services to the community with the Federation with more collaboration. A little bit overview of the company. We were established in 2012, and we are AQP for certain services. We have hold 54 active contracts in different CCGs, and we accelerate patient diagnosis risk management by use of advanced technology and experienced staff. So it's every year we learn from our experiences, and we are growing both geographically and with more services. It's been a wonderful start of the year. We have recently got our C2C inspected and rated good. So our inspection was held in October last year. So this January we got the certificate of being good in all categories in C2C inspection. We do a lot of different services. We start from ultrasound, non-obstetric ultrasound services, dermatology. We have recently started GI services and endoscopy in Bradford CCG. We do eye services, audiology, MRI, and physiotherapy, but only the board ones are the services we are providing in Bradford CCG. I would like to take this opportunity to introduce our entire team, especially for the endoscopy part of it. I would like to have Dr. Laman with me so we can do the proper introduction for the team. Dr. Laman, if you can join me.
Thank you very much. Thank you for all of you. You have always supported us. We have just recently got a contract of endoscopy and gastroenterology services and we have launched this recently. So I would like to introduce our team so that all of you guys see and what our team is and how we have started, so we can progress further. We have the same type of relationship as we in ultrasound. We want to study the same relationship in endoscopy. So I would like to invite Dr. Abdul Hassan Naqvi. He is a consultant gastric surgeon and general surgeon. Is working as an honorary lecturer as well as consultant in enforcement. Dr. Banerjee is also another consultant colleague. He is also a general surgeon and working in from Manchester. Dr. Kareem is a general surgeon and colorectal surgeon working in Manchester. Is my ex-colleague as well. Dr. Vinod is a consultant gastroenterologist working with me, one of my ex-colleague as well, and is at the Inside Hospital in Manchester. Helen is the lead in charge of the nurse, but she's also an advanced practitioner in gastroenterology. So she asked, and all these are with the team of Jack. Zishan. Zishan is our project manager for endoscopy, and he has done we provided this service in the past at Stepping Hill Hospital in Manchester, at Williamshaw Hospital, and we also provided the services at North Manchester Hospital. So now this is the first time we have started our service in the community. So this is our great team, and I would like to thank all of you. These guys will be doing the clinics on a regular basis. Thank you very much. These consultants have started the clinics already, and they are doing. We have started at first clinic at Clarendon Medical Center, and we are doing fortnightly the clinics, and have a plan to do every week. We are doing at the moment on Sundays. So as the team goes, at the moment we have got our 20 consultants with us, and 70 nurses which is in our team for conducting endoscopy services and gastroenterology services. So I will hand over to Yasir to explain about gastroenterology services further. Thank you.
My name was that I'm Yasir and I'm responsible to the relationship management. Alright, as Dr. Kumar mentioned that we are commissioned for GI endoscopy provider, as an AQP provider. We are providing both the consultation and getting the procedures done as well. It's a consultant-led services. One of the USP is since we have the ultrasound contract as well, if the patient requires an ultrasound, we do the ultrasound under the same appointment. So if the patient has come for a consultation for the GI services and requires an ultrasound appointment, and the same building in another room we are having an ultrasound clinic, so we'll book the patient for ultrasound clinic there and there. So the patient don't need to come twice for two different services. So it's a one-stop clinic in the same appointment. We are providing OPD consultation, GP direct access for endoscopy, is including gastroscopy, colonoscopy, flexible sigmoidoscopy. We do follow-up consultation after the procedure. We have if you're using our ultrasound services, you must be aware that we have a dedicated GP line on which the GP surgeries can call directly and get their queries answered. It's not like a normal call center, it will be a senior person sitting and taking the call so they can resolve the issues then and there while the surgery is on the call. These services are provided as per JAG standards, so whatever we're doing is according to the standards outlined. We can be referred patients can be referred to us through electronic referral. We have circulated hard copies of the referral form to the surgeries. We can send electronic copies as well. We are also, our clinic is available on ERS, Fusion Books, and our clinics are directly bookable as well. So if the surgery wants to book the patient while referring, they can see the available slots on the Sundays, whatever clinic we have, and they can book the patient then and there. As soon as the patient is booked, the patient will get an automatic SMS that your appointment has been booked at this surgery at this time. But somebody from our back office will be calling the patient as well, just to confirm the patient's availability. And one day before the clinic, we also call the patients to get the confirmation that are they attending or not. So we are providing the first consultation appointment within a week of the referral, which is pretty quick, I guess. And the reports are sent to the GPs within 24 to 48 hours of the consultation appointment. So one-stop clinic, if the ultrasound is required, we'll do the same under the same appointment, same location. CT and MRI, we are getting it done at Yorkshire Clinic. We have a contract with them, so if the patient requires an MRI or CT scan, if the consultant feels that they should go through this diagnosis, it will be done at Yorkshire Clinic. But we'll take care of it. We'll refer them to for onward diagnosis. Endoscopy conducted within 4 weeks from the referral. Currently, as a temporary setup, we are doing the consultations ourselves, and we have a contract with Yorkshire Clinic, and we are booking patients there within 4 weeks of the referral. We are in process of acquiring the Mediscan's endoscope mobile van, which should be placed at the Clarendon Health Center, and then we'll be doing the procedures ourselves. When we have this van with us, which will be from April this year, then the waiting time from referral to the procedure will be 2 weeks, which is currently 4 weeks. So that will be applicable April onwards. But right now it's 4 weeks time, which is still pretty much quicker than the hospital. Follow-up appointments within 1 week of endoscopy. So right now what's happening that when we get the referral, we book the follow-up appointment on our system on the 6th week. So we target ourselves that we need to complete every part of it within that period of time. So within 6 weeks, the patients are discharged after this procedure. If the patient is identified as a 2-week wait during the triage process, what we do, we refer the patients to hospital through ERS, so we have access to the system. So if at the referral stage or at any stage from referral to diagnosis to the discharge, if we see any red flag, we can refer the patients directly to the onward hospital through ERS. So we have that kind of access and we are doing it. One important thing that GPs are requested to conduct the following investigations before they refer patients to us. So it will speed up the diagnosis process. That includes LFTs, CRP, blood count tests, and UNEs. This will help reducing the diagnosis time. So when you refer the patients to us, these tests should be done during the time of referral, or ideally before that. This is our KPIs. So we have started the service. It's been 2 months since we are running the services. So our outpatient department is maximum 2 weeks. We can reduce it because if we have the capacity, but as well as we grow the referrals, we'll bring more clinics and more consultants. So our capacity is there. It's just about it will be in correlation with the demand. So we have 2 weeks for outpatient appointment. Colonoscopy is when upper GI endoscopy is being done in 4 weeks from the date of the referral. So far we have seen 52 outpatients consultation appointments we have done. 3 colonoscopies has been done and 17 endoscopies has been performed at the Yorkshire Clinic. And referral to discharge, currently we are at 7 weeks. So from date of referral to discharge is total 7 weeks time. Current RDT position is 100% and diagnosis test within 6 weeks we are at par. This is a slight overview of what patients are thinking about our services from every aspect. So if you can see that patients are happy with the efficiency of our services, time of consultation, cleanliness of the room. So from every part of the service we are getting very good feedback from the patients and from the referring GPs as well. There are few exclusions we cannot accept that if the patient has rectal mass, abdominal mass, suspicion of cancer, and we cannot see patients under 18 years of age. That's the contractual binding we have in our contract. Currently we have one clinic at Clarendon Medical Center where we're seeing the outpatient appointment and we're doing ultrasound there as well. Endoscopy mobile unit will be there and we will be operational inshallah from 1st of April this year. Currently CT, MRI and endoscopy we are getting it done at Yorkshire Clinic and we have specialized availability of the department. So when our consultants refer the patient for the procedure, we get the appointments from them very quickly. All our staff who are involved in these services are JAG accredited and for GMC folk and specialized register for NMC. All staff meet the general and specific audit standards, including full induction, which includes familiarity with all the relevant JAG standards. Individual KPI for individual staffs are constantly collected and assessed, and that's a continuous process. Complaint response, we have a separate complaint department which they operate under the guidelines of the NHS, so we respond to the complaints as per the standards. We have a dedicated quality staff to visit the clinics for quality checks. We have an external staff, a field staff, that visits our clinic unannounced to see how's everything going. If they find anything, they report back to the office. So it's a continuous process. If you're using our ultrasound service, you must be signing those GP survey forms that we collect every quarter. So we take feedback from the GPs as well as they're referring patients to us, so if they're getting appointments on time and the reports. Patient satisfaction from after every consultation or procedure, which I've shared the outcome. So that was the GI services part. Endoscope, ultrasound we're doing for like 5 years of time. I'll just go quickly through it. Our USPs are we scan within 5 days of the referral. Within 2 days, we respond to the GPs with the reports. And rest are, I think you must be familiar with all these. These are our clinics. Currently, we are providing ultrasound services from these clinics, and we are willing to expand the services in more practices. Okay, so I will be how to refer. These are the email addresses, and you can find. We have left marketing tags as well. All the information is there, and that's our contact addresses which are included in there. So if you have any query or question, the email addresses by heart is there in marketing tag. You can call us anytime and send us an email. I'll be glad to answer you. Thank you so much for extended time. Thank you.
So just as a summary,
all of you are, we are doing a dinner in Manchester on Saturday, and I think we have invited all of you guys, so kindly come and join us in the annual dinner of Mediscan.
That's your age, that's your age.
Yes, that is our age. Thank you.
Everybody, including their families.
Yes.
No, you said, I know, so I mean, that's an open invitation. Just to clarify, so in summary, it's a new service in collaboration with Mediscan and City Federation. It's not a Clarendon Medical Centre service. It's based at Clarendon because we have to get started somewhere. Clarendon, because of its access from Manningham Medical Centre, has a lot of space in terms of parking and mobile units. But the service is a City Federation service, same as the ultrasound diagnostic collaboration that we have. So it's really important that we look at those patients that meet the criteria and that you feel potentially would benefit from a GI clinic, an appointment with a consultant within 5 days, and any other relevant investigation. So we can follow that up through the Federation in terms of, you know, improving engagement with that service. But thank you very much, Numan, and your team for coming here today. Thank you.
Thank you, Ish, for clarifying that. Should have had a big conflict of interest on that. Yeah, absolutely. I mean, I think the service feedback that we've had from the consultants that provide the service, from the Mediscan service, has been absolutely brilliant. Our patients have really appreciated it. And I get feedback from my staff also, and I get, to say, yeah, what do they think about this service? And we've got very, very positive feedback. So, yeah, keep up the good work. So I hope the collaboration will continue and grow. Well, just a quick word that we've got also local AQP providers in Avicenna providing us services. New partners, so if you want to support that walking service, probably the longest walking service that's been around in the city. It's at the moment at Avicenna, and also operates in hopefully some of the other city practices. So yeah, so please support that. Local services, system one, good access, good reliability and everything else. And also, Amber's not been here today, but there's a collaboration between City Health and the family practice with regards to their AQP skip service as well. So again, support our services on electronic referral system, so please and encourage you to support that service. So now we're going to close to members' meetings. So hopefully we go through all the nitty-gritty, the finance and the contracting and all the other bits as well, which I'm sure you're all keen to hear about. I'd like to say thank you to all of you to come to this meeting today, in particular all our partners, and yeah, hopefully I'll welcome you all next year as well. Okay, thank you, take care. Get 5-minute break, go for a quick coffee, and then we'll start with the finance. Is that okay?